The center started with 4 faculty, Jeffrey Joyce, Darius Lakdawala, Neeraj Sood, and I, working out of a condemned library on the edge of campus.
And a decade later, the center supports over 120 people, including 3 Nobel Prize winners and many, many outstanding scholars. But size is the least important metric. Dana's leadership established an organization renowned for quality work that's impacting public policy and healthcare practices across the nation. The center has been named and specifically cited in the decisions and work done out of the White House, the Congress, CMS, FTC, state and local agencies. In addition to establishing this national reputation, Dana and his team have worked with countries around the world to better understand how they will be affected by their aging population. Center scholars understand the need for policy relevance and timeliness, and the center has been on the forefront of analyzing the most pressing health problems over the last 10 years, including the Affordable Care Act, pharmaceutical pricing, new payment models, the opioid crisis, and antibiotic prescribing, just to name a few.
The Schaeffer Center may be only 10 years old, but it is a towering adult in the world of health policy already. We celebrate tonight the memorable work that Leonard Schaeffer has accomplished in his commitment to caring and to affordable health care for all of us. Practical innovation characterizes the Schaeffer Center.
Its brilliant faculty and researchers know that you have to understand a problem before you can solve it. That is why they focus their energies on some of the most difficult problems facing America, such as rising insurance and drug costs, unequal access to medical services, and healthcare reform. It's where people go for research, for wisdom, for guidance. In our world today, we hear a lot of talk about problems. What we don't hear about as much are solutions. The center points us towards solutions.
These women and men energize and execute Leonard Schaeffer's vision of improving health care for all and making it available to everyone in this country.
Tonight, we can look back on the last 10 years in healthcare. And we've seen great advances in medicine, but we've also been saddened by the rise in deaths of desperation. We have reduced the number of uninsured, but we've seen healthcare costs continue to go up at what is clearly an unsustainable rate. So in healthcare, I guess the problem is that change is the only constant. For the center, however, change is not a problem. Firmly established as a leading research institute and think tank, the center will continue to address the nation's most pressing healthcare problems. At the same time, the center is well equipped to tackle new questions with energy, innovation, and rigor. Going forward, you can count on 2 things. The center scholars will continue to do outstanding, meaningful work, and I will continue to try to take credit.
We look forward to you joining us again when we celebrate our 20th anniversary.